Hi, and welcome back to the Beauty Lab podcast. I'm your host, Monina, and my co-host, Velia. Today, we're going to talk about kind of an emotional subject, and it's about hair loss. Okay, so I know a lot of you, this is an emotional topic, and that's why we wanted to talk about it again. We have spoken on this in the past, but I know Velia is passionate about this and wanted to come back on here and talk a little bit more about it. I have some newer questions, so let's start with the first one. The first question is, so the emotional and psychological impact of hair loss from your perspective, because I'm sure you get this a lot in the salon. Talk to us about that.
Yeah, so hair loss is such an emotional subject for people. And I think part of it is because we identify with our hair. Like, our hair is part of our identity, right? So I think it not only does it have to do with like the signs of aging and those in that direction, but I think it's also like we have an idea of what we look like, and it's not always accurate. I mean, sometimes it's worse than the truth, but sometimes it's better than the truth or whatever. And like, you know, you look at yourself in the mirror sometimes and you're like, oh, that's what I look like.
It's true, because when I have a bad hair day, and usually when I say bad hair day, it's a bad bangs day.
Yeah.
It just makes your whole face look different. I don't know, when you look in the mirror. So
yeah, you know, I always tell my kids that adults are just teenagers who have more responsibility, you know? So it's like we associate our whole lives, like we basically just behave like we behaved when we were a teenager. Like that's what we think about. That's what we think we're capable of doing, even physical things that we could do like when we were a teenager. Like, you know, you and I and Jen actually were at the beach a few months ago, and I was like, I want to do a cartwheel. I haven't done a cartwheel in like 7 years.
I think, didn't we try, and didn't I hurt myself?
No, that was me. That was me hurting myself. So, I mean, not to get off the subject of hair, but I think it boils down to we identify with a particular part of ourselves that is still in there, but doesn't quite match the physical sometimes. So everyone's going to lose hair. And I can say that and sound like it doesn't apply to me, but it does apply to me because I also have lost hair and it also affects me. But I think that the psychological piece to it is really not talked about enough. You know, I think we used to just kind of talk about it as far as men and men having like, you know, the male pattern baldness and all of the
receding hairline.
Right. And like Bosley, you know, commercials on or Rogaine commercials or whatever. But really women experience the exact same thing, maybe not like with a huge bald spot on the top of their head, but sometimes that, you know, and it still really affects how we feel about ourselves and our self-esteem, how we value and perceive ourselves. You know, it affects your self-confidence. And the bottom line is really like, it all goes back to how, like, the truth that we tell ourselves, right? Our truth about us. So like, if I didn't believe that I was the dumbest person in the world and you told me all the time you're the dumbest person I've ever met, I wouldn't care that you said that, because that's not my truth. You know. So, and the same thing goes for something positive. Like if I don't believe that I'm beautiful or you know, whatever, I'm smart even.
It's your belief system. And nobody's gonna change it depending how strong your belief system is.
Exactly. So when your truth to yourself is that you're not worth as much, you know, even you're not as attractive, you're old, all of those kinds of things because of hair loss. That really does affect the way you feel about yourself.
Absolutely, because to me, like when you see a woman losing hair, like a lot of it, for whatever reason, maybe it's alopecia or maybe she had a bad perm and now they had to cut all her hair off. To me, when I see women, and this is my belief, is they're sick. because they're going through radiation or chemo, so they've lost their hair. So to me, long hair means health, like having a healthy body and a healthy
Long,
lifestyle.
shiny, thick hair.
Exactly. So that's that for me. So when I look in the mirror and if I'm losing hair or even like what hair I have, it's turning gray or whatever, I'm associating it with like not being young and healthy.
Exactly.
Yeah.
Exactly. And that is not necessarily the truth. I mean, we're all going to lose hair. Every single one of us is going to lose hair. That doesn't mean we're all going to be bald, but we aren't going to have the same amount of hair in our, I mean, even if we're in our 40s. I mean, that's when women start losing their hair, is like in their mid 30s. So by the time you're in your 40s, you are going to notice.
You're going to start to experience some hair loss. Yeah, also because of the shift in hormones, because like we've been talking about, right? Pre-menopause and menopause and post-menopause, like your hormone levels dictate so much of things like hair loss.
Right.
You know?
And my clients, you know, because I see my clientele is basically, I mean, I have some clients that are younger than 30, but most of my clients, I would say, are 30 to 65.
Okay.
And every single, male and female, every single one of them ask me about thinning hair. Like, does my hair look thinner this time? Does my hair look thinner to you? Does my hair look thinner? It's a question I get all the time. I even have some clients who are so paranoid about it because they did go through a stage of life where they lost a significant amount of hair, or to them it felt significant, to the point where they wake up in the middle of the night and go check their hair to see if they look balder, than they. And it's not ridiculous. It's sad and it's disturbing. But, you know, a couple months ago, I had COVID. And about a week after having COVID, I lost a bunch of hair. And that is a side effect of
we
having
actually
COVID.
saw that, right? A rise in that during 2020, 21,
right?
Everyone coming out of COVID.
Yeah. And I noticed that I am so paranoid about, because I still feel like I'm shedding more than I should be, or more than is normal for me. So I get it. And especially if you're like trying to grow your hair out or something and you're like, I just made progress and now I'm like shedding all this hair and now it's looking thin on the ends and I have to change my plan. So it's disruptive.
You
Yeah.
know. Do you feel like some of the hair loss though could be prevented? Maybe lifestyle choices,
Definitely.
things that we eat.
I think some of it absolutely can. I think some of it is, sometimes it is self-inflicted. And that doesn't, I don't mean that in any kind of negative way. I just
no
mean
judgment. It's just that, it can be self-inflicted and
Yes.
you not even know it.
Correct.
Maybe. Okay.
Yes.
Right. Okay. Yeah. I mean, gosh, we could talk about the emotional part like all day long.
Yeah, my clients will show me pictures. I mean, they'll come in with tons of hair still, like 5 times the amount of hair that I have. And they'll still show me pictures of them 2 to 10 years ago. And they're like, but look at all the hair I used to have. And so they're still associating their identity with that person, that version of themselves from 10 years ago, which, 10 years ago.
I know there's a lot of differences from 10 years ago.
Yes, of course.
Yeah, so I guess what you're saying is just don't dwell on what you used to have. Like, enjoy what you have and then try not to self-inflict further loss if possible.
Yeah. And it's just like, you're not alone. Mostly.
Exactly.
It's just, we can relate. I don't necessarily have I'm not a psychologist, so I don't have any great advice or any words of wisdom necessarily, other than it is normal. It is expected. You don't have to like it. I don't like it, but it's gonna happen and you're not alone.
You're not alone. And if you're dwelling and stressing on it,
that will make it worse.
That'll make it worse. So maybe that's the part of the emotional and mindset part that we can all work on.
Yes.
Right? Okay. Great. That's awesome. Okay. My next question is, what are the common causes of hair loss besides genetics, because I know you did a deep dive on genetics in the last episode.
Yeah.
What episode was that again?
That was episode 22.
22. So if you want a little bit more deeper dive as far as like some of the genetics that cause hair loss, please go back and listen to that one.
Yeah. So some of the causes besides genetics are hormone changes. So there's different types of hair loss, and the technical term for hair loss is alopecia. And I do, like Monina said, I do a deep dive into all the different types of alopecia in episode 22. So if this is something that is weighing heavy on your heart or in your mind, affecting you every day, and I think that that's a really informative episode. Androgenic alopecia is usually the kind of alopecia that everyone, that's like the basic, you know, we're getting older and we're going to lose some hair. And that just has to do with lower estrogen in women. It's not so much that, you know, we wind up getting more male hormones or the androgens, but our estrogen lowers, and then it offsets the balance of our hormones, which causes androgenic alopecia.
Okay.
And that's usually very evenly spread hair loss. You know, it's not like big patches or anything like that. Sometimes you know, it's very normal for people to have the majority of their hair loss around their hairline or on the top of their head, unfortunately, because that's like where we all see it.
Yeah. That's where it starts.
Yeah, exactly. But hormone changes like pregnancy, you know, menopause, perimenopause,
Like all that.
all the menopause.
Yeah, and I
things.
do remember, like, I wasn't told this, right? So I remember when my son was born, I did notice, like, my hairline looked like it was receding.
Yeah.
And I freaked out. But then I think then you told me, or someone mentioned, yeah, that's temporary though. Like
Yes.
that hair, if you lose it because of pregnancy, it actually comes back. It's, again, it's the imbalance in the hormones during pregnancy that cause that.
Yes.
Okay. Yeah.
And that's a different type of alopecia called telogen effluvium. And that's basically, and there's other triggers for telogen effluvium, like stress, but you know, it's not so much like your normal levels of stress, or what we consider normal. Maybe not Bay Area normal levels of stress, because that's probably on the super duper high end of stress levels for most people.
Yeah.
We do happen to live in a rat racy environment here in the Bay Area.
Hustle culture.
Yeah, exactly. So we typically are in a more stressed state of heightened stress than some other areas. But also nutritional deficiencies. If you're lacking in iron, if you're not eating enough protein, zinc is another one that, like, you know, people don't think about. They just usually, when they start noticing hair loss, they start taking a bunch of collagen powder or whatever, and they think they're doing themselves a favor. But there's so many different vitamins that, you know, most people don't take any vitamins, and they probably aren't eating all the vitamins they need every day. So again, a lot of these things, when I said self-inflicted earlier, this is kind of what I'm talking about, is like not taking care of yourself in the basic ways, like taking vitamins and eating right, eating healthy. I understand lifestyle gets in the way, like your day is long and sometimes you don't have time to like prepare and all of those things. So so some of the vitamins that you want to make sure that you're getting enough of are iron, zinc, biotin, that's vitamin B7, vitamin C supports those other vitamins, absorbing other vitamins, and vitamin E as well. Omega-3s, and you know, that goes back to protein.
Right.
Yeah, eating lots of protein. I mean, your hair is protein.
Yeah.
So you can't make hair if you don't have
the tools.
To make hair.
Right.
So those deficiency in vitamins, that's all part of telogen effluvium. And basically what telogen effluvium is when, so there's different stages of hair growth. And when your hair is in the growth stage, that's called the anagen stage. And so what telogen effluvium is hair from the anagen stage, so hair that should be in that growth stage for years, like a lot of that hair goes into the telogen stage, which is the shedding stage. And this is why, it's usually diet, stress, big changes in hormones, medications, starting or stopping different medications.
Okay. That triggers the
Effluvium.
effluvium.
And typically telogen effluvium, if you've experienced telogen, like me with COVID, it will grow back. If it's a medication that you've just started, I would talk to your doctor. I am not a doctor. I will not tell you to stop taking that medication, but I will tell you that if that is a side effect, tell your doctor, because they might not want you to continue that medication, or maybe there's like a different medication that does the same thing that doesn't cause hair loss.
Right.
And if you stop the thing that you're doing that puts you into telogen effluvium, your hair should grow back.
Yeah. So that's how you know it was telogen effluvium, because it actually grows back.
And it's usually a big sign of it is that you all of a sudden you're losing all of this hair. And you're like, why am I losing all of this hair? Whereas, if your little pile of hair in the shower goes from like this tiny little ball to like a bigger ball, and you're noticing that more than once in a row, then I would start paying attention to what you're doing, what you're eating, your stress levels, all those kinds of things. There's also autoimmune conditions that cause what's called alopecia areata. Alopecia areata can also be, I've seen it from COVID, having COVID, when alopecia areata is actually like round, bald spots, like completely missing hair, not just thin spots, but bald. And that can be so emotional. I'm usually the one that points it out to my clients, unless it's somewhere they can see. They notice that they've lost hair, but they can't see
pinpoint where
it has been lost. And when I show them, I take a picture of like their bald spot that's like the size of a quarter in the back of their head, it's shocking. It's shocking. It's disturbing. But there is treatment for that. And if you have alopecia areata, you should definitely see a dermatologist, and they can help you. There is a treatment for that. There's a corticosteroid injection that they can actually inject into the.
And then that helps regrowth. To start again. Wow. Okay. Yeah, and I remember you saying that if you do have hair issues, that if you're going to a medical doctor, it's a dermatologist. That you want to talk to.
Then the last way that we kind of see hair loss happening is from what we call like traumatic hairstyling. So that's basically pulling the hair too hard for too long, really tight braids or really tight ponytails, and that's called traction alopecia. And that's also usually is reversible if you stop doing that.
Is that the one, because I'm trying to remember back from the last episode, is that the one where you're actually, if you cause scarring in the area, it won't grow back? Because you've developed, because it's trauma, so then there's scar tissue, and then it doesn't grow back.
It's inflammation. So it starts off with, you really tight braids or really tight ponytails for days in a row, if not weeks or months even, and you don't see it. You can feel it though, because it kind of hurts. Some people have really sensitive scalps. Some people have I don't understand how they can handle some of the stuff that they do to their hair and it not hurt. But anytime you're like pulling your hair away from the direction that it's growing, it's going to cause a little bit of inflammation. Most of the time it's a short period of time, But if it's a long period of time, the longer it goes, the longer you allow that to go, the little bit of inflammation can turn into scar tissue, and then the scar tissue will not grow new hair.
So people who go to bed with their hair in ponytails, not a good idea.
So I'm not like really a big fan of going to bed with ponytails, but there's a way you can go to bed with your hair in a ponytail if it's like a low ponytail and it's not pulling your hair in the opposite direction of the way it's growing. So like if you just kind of do like a low ponytail and it's not super tight.
Right.
You know, so I would, if you have long hair and it chokes you in your sleep, I would just braid. I would probably put my hair in a braid, or if you want to put it in a ponytail, that's fine, or a bun or something like that.
Just a
Loose. And if you need a little something more, maybe like even use a bonnet or something. Yeah. You just don't want to pull your hair all the time.
Yeah, because you're trying to sleep and then there's all that pulling on the scalp. It's not, can't imagine it being comfortable.
Yeah, no, it isn't comfortable.
Yeah. Okay. Well, I have one more question, but before we do that, I just wanted to say thank you again, everyone, for always being here every week. So if you find this valuable, or you know of someone who may be going through some of this stuff right now and you feel that this could help them, please share it with them, and also like, share, and subscribe. It really helps us out, and we really appreciate all the love that you guys have shown us these past few months. So really appreciate that.
Also,
yes,
to give back for all the love that you have shown us,
exactly,
we would like to show you some love and thank you for being the best community a podcast could ask for. We've got a little something special for you from Velia Beauty Co., the hair care line that's all about giving your hair the love and nutrition it deserves. These products are packed with natural mineral and plant proteins, leaving your hair strong, resilient, and super shiny. And get this, they're cruelty-free, sulfate-free, paraben-free, and safe for colored or keratin-treated hair. As a thank you for being a part of the Beauty Lab family, you can get 20% off your entire product order at veliabeautyco.com. Just use the code TheBeautyLabPodcast at checkout. That's The Beauty Lab Podcast, all 4 words, all caps. We'll link it in the show notes.
Yay! Thank you. So there's a nice little gift for all of you guys. So please definitely look in the show notes. Okay, I do have one more question. The last question is, what are some modern treatments, because we're seeing a lot of that now that hair loss is really becoming a big thing. What are some treatments, and talk to us about the realistic expectations, maybe like holistic or natural treatments? Like what are you seeing, or what would you suggest?
Okay, so the medications that are available now are tried and true. Minoxidil, I'm sure everyone's heard of Minoxidil at this point. Rogaine, if you haven't heard of Minoxidil, the active ingredient in Rogaine is Minoxidil. Minoxidil used to only come in a topical form, and now it comes in a pill. So if the topical form isn't working for you, you can also take the pill, and that is for women as well as men. I know a lot of people who started taking Minoxidil in the pill form, and it does work much faster than the topical form, and they've been really happy with it. One thing I will mention with Minoxidil in the pill form, this doesn't really apply to the topical form, because the topical form is usually in, they make it in shampoos, and there's also like serums and drops that you put on your scalp, and you like massage it into your scalp. So you're applying it directly to your scalp. That takes a little bit longer to see results, but it is targeted to the one area you want hair growth.
Okay.
So Minoxidil in a pill form will go through your whole body. So I know that women, especially men probably wouldn't care much, but women have reported that, they're noticing hair growth on their face. Nobody I know is growing a full beard. I probably would, knowing my luck, if I ever took Minoxidil, but so far no one's reporting that dramatic of a negative kind of side effect. But these are, you have to weigh your options. If you're somebody who really wants to try this, then,
Now, is the Minoxidil a prescription?
Yes.
Okay.
It's a prescription. I think there are some websites, that like hers, I think, has it.
Got it.
And I'm not sure. I've never ordered anything off of hers, but I think you do have to have a prescription to order through that.
I mean, just because I'm thinking, you mentioned you might get facial hair.
Yes.
And that's kind of telling me maybe it's doing something with your estrogen and testosterone levels maybe. And so maybe it's a good idea to talk with your doctor before you, if you're, let's say you're on HRT or something else. You know, maybe there's like a contraindication between what you're doing now before you start using the minoxidil.
So actually what minoxidil does is so remember I talked about the anagen phase and the telogen phase. So what happens when you start noticing hair loss is those hairs that go from the anagen phase to the telogen phase, and the telogen phase again is when your hair is shedding. There's usually like a normal time period before that same follicle that just shed the hair starts to grow another hair. So when you start seeing hair loss, that's more of a permanent hair loss. The telogen, the hair that was in the telogen phase that's supposed to be going back into the anagen phase again, doesn't go back to the anagen phase. It just kind of like it usually just takes a little nap, but sometimes that follicle doesn't want to wake up. So that's usually because of age and other things. I'm not a doctor. I'm not going to try to explain all of those things. But what minoxidil does is it actually encourages the hair that's asleep, the follicles that are sleeping, to go back into the like wake up and get back to work, basically.
Okay, so minoxidil is targeting follicles that are just asleep for whatever reason. But if that follicle is just no longer producing, it doesn't matter how much minoxidil you're taking, it's just not going to grow.
Yeah, so you know, unfortunately, there's never like a guarantee, but a lot of people do see really, really good results, really positive results. And I think when you have hair loss, any improvement
is a good thing.
Is going to feel good.
So I'm thinking minoxidil then is probably really beneficial for the self-inflicted hair loss, it sounds like, because whether it's nutrition or the pulling and the trauma that you've inflicted on the hair can maybe put it into a sleeping mode, and maybe minoxidil is good for that then?
I think that if you've lost hair from traction alopecia, I'm not sure how much minoxidil is going to help you. I'm not saying it won't, but I wouldn't count on it because that's usually a scar at that point.
Once it goes into a scar, then there's really nothing you can do.
Yeah, and then as far as like the nutritional stuff, normally if you just get your nutrition back on track, you're fine.
Oh, that's
true.
true.
Because it's not necessarily a sleeping follicle. It's more of
deficiency.
It's more just a deficiency.
Okay,
and your body's really smart, so it just starts losing the things that it doesn't have the resources to continue to foster the health of.
Got it. No, that totally makes sense.
Yeah. And then there's finasteride, which you might know as Propecia, and that's a pill, and that is for men. I think they've started using finasteride in some post-menopausal women if they haven't had luck with minoxidil. It is definitely known to cause birth defects in babies, so you don't want to be of child-rearing age and use finasteride if you're a woman. And then there's Spironolactone, which is a prescription medication used, it's like a diuretic, and it's also used for high blood pressure. So it's like an off-label, like it's not a hair growth drug.
Right.
It's just happens to block the androgens as a side effect. So that can help sometimes with androgenic alopecia, which is the alopecia that you experience when it's just with age mostly. And then there's in-office procedures like PRP, platelet-rich plasma, which is injections. And then again, for alopecia areata, there's the corticosteroid injections. But the corticosteroid injections are only, to my knowledge, used for alopecia areata because that's an autoimmune thing, and that's why it's a steroid.
Now, once you get the steroid the one time, is this something you have to keep going back in for?
That depends on the person, because I have had clients get one shot, or not one shot because they do like multiple shots, but one session. And they've had really good results with that one session. And then I've had clients who have gone in for multiple sessions and their dermatologist is like, you still need more.
Okay,
but
so it just depends on your specific case.
Yes.
Okay.
Yeah. And then of course there's the surgical options of hair transplants.
Right.
So
Good old transplant.
Good old hair plugs,
Yeah.
hair transplants.
Right.
You know, we do see a lot of like on TikTok, like rosemary oil has
To grow the hair?
so so rosemary oil, rosemary in general, and castor oil is another one. A lot of times they're mixed together. That is definitely something you can try to not to wake up the sleeping follicles because it's not gonna do that, but it will encourage healthier growth in the follicles that are already producing hair.
Oh, so it's just going to improve the health of hair that's still growing.
Yes, it's going to improve the health of the hair that's still growing, and probably sometimes maybe
Okay, all
that's as
right.
much of a guarantee as I can give.
All right.
Will help it to maybe grow a little bit faster because of the circulation that castor oil and rosemary oil induce.
Yeah.
And then also like the massaging your scalp because you're massaging it in.
Right.
Also helps improve the circulation.
Right.
So it's not going to do what medications can do, unfortunately.
But it's a nice holistic way to.
But you can try it. It's not going to hurt. But here's the thing I'm going to say about that. Don't leave the oil on your scalp. If you're going to try a rosemary or castor oil treatment, it's something that you want to do about 30 minutes before you wash your hair. So don't leave it on your scalp any longer than 30 minutes.
30 minutes.
It's not going to do anything good after that,
Right.
you know, anything
Anyways,
beneficial after that. It's only going to do bad things to your scalp after that because oils on your scalp will feed any kind of fungus on your scalp, and the fungus lives on your scalp. It lives on everybody's scalp.
Right.
So don't give it food.
Yeah.
Otherwise,
it'll just proliferate
yes,
throughout. Yeah.
exactly. And then I guess there's derma stamps. Have you ever used a derma stamp?
What's
so it's basically like micro needling, but like not as intense as deeply penetrating as a micro needling session. So I guess it's like a little pad with little teeny tiny, we'll call them needles. And if you kind of press it on the areas that you feel like you want to grow longer, faster, healthier, you can kind of, it just basically penetrates the rosemary oil a little deeper.
Okay. It's just creating little micro perforations in the scalp.
Exactly.
Okay.
And then it'll get the product in a little deeper.
Wow. And that's called stamping?
Derma stamping.
Derma stamping.
Yeah.
Is that something you go in to get done? Or is that something you do at home?
You know, I bet there's like a DIY version of it.
Okay.
But I mean, I don't do derma stamping like in the salon. I don't really know. I don't know if that's within our scope. I'm sure it isn't as a cosmetologist.
Yeah, sounds like a dermatologist practice.
Yeah, maybe
But,
even
I mean, ask
medical
your,
spas or something.
med spas. Anyone who does hair loss treatments, I'm sure they'll have it.
If you've ever tried derma stamping,
let us know.
Also, if you've ever tried rosemary oil or castor oil for hair growth, I am so curious. I haven't tried it on myself, but I mean, I've only ever seen people online say it works.
Yeah.
So if you're watching our show and you are brave enough to give us your testimony on rosemary oil or castor oil, as far as like things you've tried at home, let us know because I want to know.
Now, is that the castor oil and the rosemary? Do you mix those together? Like, is the castor oil like the carrier oil and the rosemary is the?
Pretty much.
Okay.
Yeah, pretty much. I mean, you don't need a lot of rosemary.
Right.
It's rosemary in general. Like you could tell even just by its scent is very strong. Yeah. So there's different concoctions you see in holistic books and even Pinterest.
Oh, yeah.
Yeah, different recipes on Pinterest that I have seen.
Yeah, so if you guys have a recipe, let us know. Share.
I've also heard castor oil grows eyebrows, like your eyebrow hairs back.
And well, that's one I'll have to try.
And eyelashes.
Yeah, I've heard that. I don't know, castor oil getting in the eyes.
I know.
That's the only...
Because it's so thick.
Yeah, that's the only thing I'm afraid of. So,
yeah.
But the brows, for sure. Give it a try.
Okay, if you've tried castor oil by itself, I want to know.
Let us know.
Yeah.
Okay.
Should we try it?
Yeah. All right. Well, is there anything else you wanted to add? Was that pretty much it? Okay. That's it. If there's something we didn't cover or you have a question after listening to this, please send us a message. We always read the messages,
Yes.
and we want to make sure we cover things that you're interested in. All right. So again, thank you so much for being here every week. I'm Monina.
I'm Velia.
Until next time,
Keep experimenting with your beauty routine. Should we just,
Oh,
okay. These are more fun, I feel like.
I know.
Okay. Where are we at? Okay.
Just
Close
making
enough.
sure.
Close enough. Sorry, Jen, if you have to do a little something there.
Readjusting.
There we go.
Thumbs out. Okay. All right. No bras. Okay. There we go. Okay. Okay. There we go. Pause. No.